Are you feeling pain during or immediately after intimacy? That moment that should be about pleasure and relaxation has turned into discomfort, burning, or even intense pain. If this is happening to you, I'm sure you're worried, confused, and probably avoiding intimacy altogether out of fear of feeling that pain again. Take a deep breath, because in the next few minutes, I'm going to explain exactly what can be causing this pain, when you really need to worry, and most importantly, what you can do to solve the problem and get back to a healthy, pleasurable, intimate life. I'm Dr. Amelia Tiller, and here on Male Secret 60 Plus, we don't dodge any subject when it comes to men's health. So stay with me until the end, because the information you're about to receive can literally transform your quality of life and your relationship. Before we dive into the specific causes, you need to understand one very important thing. Pain during or after ejaculation is not normal. It's not something you have to accept as part of getting older. It's not something that will just go away if you ignore it, and it is definitely not something you should learn to live with. Pain is always a sign that something isn't working properly, and your body is asking for attention. The good news is that in the vast majority of cases, this problem can be solved, and the sooner you seek help, the quicker and easier the treatment will be. The pain can show up in different ways. Some men feel a sharp stabbing pain right at the moment of ejaculation. Others feel intense burning along the urethra. Some have a dull, deep ache in the pelvic area, the perineum, that's the area between the scrotum and anus, or even the lower back. There are men whose pain radiates to the testicles or the inside of the thighs, and there are cases where the pain only appears minutes or hours later as a feeling of heaviness, pressure, or discomfort that can last for hours or even days. Each type of pain can point to a different cause, which is why it's so important to pay attention to the details. When did it start? Is the intensity always the same, or does it vary? Does it happen every time or only sometimes? Is there a specific position or situation that makes it worse or better? Do you have other symptoms like difficulty urinating, blood in the semen, fever, discharge? All of this information is gold for the doctor. Let's start with the most common cause in men over 50, prostatitis. The prostate is a walnut-sized gland just below the bladder that surrounds the urethra and produces part of the seminal fluid. When it becomes inflamed, a condition called prostatitis, it can cause a whole range of symptoms, and pain during or after ejaculation is one of the most frequent. Prostatitis can be acute and bacterial, with fever, chills, severe pain when urinating, and feeling really sick. But the most common form is chronic prostatitis, which can be bacterial or non-bacterial and tends to come and go, causing chronic pelvic pain, discomfort when urinating, and especially pain during or after intimacy. Chronic non-bacterial prostatitis, also known as chronic pelvic pain syndrome, is particularly frustrating because often we can't find a single clear cause. It can be related to excessive tension in the pelvic floor muscles, low-grade inflammation, urinary flow problems, psychological stress, or a combination of all of these. What we do know is that it affects millions of men and has a huge impact on quality of life, not just because of the physical pain, but also emotionally and in relationships. Another very common cause, especially in more mature men, is benign prostatic hyperplasia, BPH. As we age, the prostate naturally grows. This growth is benign, it's not cancer, but it can press on the urethra and make urination harder. When there's partial obstruction, the pressure inside the prostate and seminal vesicles increases, and during ejaculation, that pressure can cause pain. BPH is also often accompanied by some degree of inflammation, which makes the discomfort even worse. Sexually transmitted infections such as chlamydia, gonorrhea, mycoplasma, and ureaplasma can infect the urethra, prostate, seminal vesicles, and other structures, causing inflammation and pain. These infections don't always have obvious symptoms at first, but as they progress, they can cause burning when urinating, urethral discharge, testicular pain, and of course pain during ejaculation. If you've had any recent risk exposure, this needs to be investigated and treated as quickly as possible, both for your health and to protect your partner. Epididymitis, inflammation of the epididymis, that coiled tube behind each testicle that stores sperm, can also cause intense pain during intimacy. It can be triggered by bacterial infection, trauma, or even urine reflux. Symptoms include testicular swelling and pain, redness in the scrotum, pain when urinating, and pain that gets worse during sex. Epididymitis needs fast treatment to avoid serious complications like abscess or fertility problems. Stones or cysts in the seminal vesicles or ejaculatory ducts are less common but can definitely cause pain on ejaculation by partially blocking the ducts and creating local inflammation. Cysts in the prostate or seminal vesicles can do the same thing when they're large enough to interfere with semen flow. Pelvic floor dysfunction is an often overlooked but extremely important cause. When the muscles that support the bladder, bowel, and pelvic organs are too tight, in spasm, or too weak, they can cause chronic pelvic pain that flares up during intimacy. This can come from chronic stress, bad posture, old injuries, previous surgeries, or the habit of holding urine for too long. Excessive muscle tension can compress nerves and blood vessels, making pain much worse during the contractions of orgasm. Neurological problems can also be involved. Poorly controlled diabetes can cause neuropathy that affects the pelvic nerves, and nerve compression in the lower spine can radiate pain to the genital area that worsens with ejaculation. Retrograde ejaculation, when semen goes into the bladder instead of out through the urethra, doesn't usually cause pain by itself, but the underlying issues that cause it sometimes do. Old pelvic trauma, even from years ago, can leave scars or adhesions that only now start causing pain during intimacy. Rarer but serious causes include tumors in the prostate or seminal vesicles and certain autoimmune diseases. Psychological factors should never be underestimated. Anxiety, depression, past sexual trauma, or post-traumatic stress can manifest as real physical pain during intimacy. The mind-body connection is incredibly strong. Now, what to do if you're experiencing this pain? First, and most important, do not ignore it. I know it can be embarrassing. I know you might be ashamed or afraid of what the doctor will find, but delaying only makes things worse. Start by writing down all your symptoms in detail and book an appointment with a urologist, the specialist in male urinary and reproductive health. During the consultation, the doctor will take a thorough history, perform a physical exam, including the digital rectal exam to check the prostate. It only takes a few seconds and is absolutely essential, and order tests, urine culture, possibly PSA blood test, STI screening, transrectal ultrasound, scrotal ultrasound, or MRI if needed. Sometimes a pelvic floor physiotherapist evaluation is necessary. Treatment completely depends on the cause. Bacterial infections are treated with antibiotics, sometimes for many weeks. Chronic non-bacterial prostatitis usually needs a combination of anti-inflammatories, alpha blockers, muscle relaxants, pelvic floor physiotherapy, and stress management. Pelvic floor physiotherapy has an incredibly high success rate in men and often eliminates the pain completely. Lifestyle changes help a lot. Avoid caffeine, alcohol, spicy and acidic foods, stay well hydrated, manage stress with meditation, yoga, or therapy. Take warm sitz baths. Use cushions that reduce perineal pressure when sitting. For prevention, use condoms with new partners, urinate after sex. Don't hold urine for long periods. Maintain regular, comfortable sexual activity. It actually keeps the prostate healthier. Stay at a healthy weight. Exercise. Don't smoke. Limit alcohol. Eat plenty of fruits, vegetables, and foods rich in zinc and lycopene. Pay attention to posture, manage stress, and get regular checkups. I've had patients who avoided intimacy for months because of excruciating pain and discovered it was just a treatable chronic prostatitis. After antibiotics and physiotherapy, they were completely pain-free and their marriages improved dramatically. Others had severe pelvic floor muscle tension from years of stress and bad posture. 6 months of specialized physiotherapy and stress management solved it. Every case is unique, but almost all of them improve significantly with the right approach. Pain during intimacy is not normal with aging. There is almost always something that can be done, and you do not have to learn to live with it. You deserve a pleasurable, pain-free sex life. Have the courage to seek help, talk openly with your partner, follow the treatment, and be patient. Most men get their lives back. Thank you for watching until the end. Like the video if it helped you, subscribe to Male Secret 60 Plus, turn on notifications, and share this with anyone who might need it. Your health is your greatest wealth. Take care of it. See you in the next video.